The commonest question every patient asks a doctor when they have a fertility problem is, Doctor, why am I not getting pregnant? And when they've done an IVF cycle and the IVF cycle fails, then the next logical question is, why did the cycle fail? Why did the embryo not implant? Now, these are great questions. No one's disputing that. The problem is we don't have the technology to be able to answer these questions. And the reason for that is, while we have technology to check if the tubes are open, we can't check if the tubes are functioning or not. So we know a tube which is blocked is not going to work, but just because it's open doesn't mean it's working. It's not a plumber's pipe. Similarly, we can do a semen analysis and check there are sperms. We can count them, but it's not like a bank account. It doesn't necessarily tell you whether the sperms are functionally competent or not. And that's exactly the problem with IVF failure. We can make an embryo, but once we make an embryo and put it back in the uterus, we don't know whether that embryo is going to implant and what causes it to implant and what causes it to not implant. Now, the honest thing to do is to tell patients the truth and say, look, we don't have an answer. Patients get very upset when they hear this because they want a doctor who will give them answers, because once the doctor knows what the problem is, of course, he's going to be able to solve it. Interestingly, in the field of infertility, our technology for diagnosing problems and for making diagnosis is actually not very good. But our technology for providing solutions is excellent. Now you may say, how could that be possible? If you don't know what the problem is, how can you identify the solution? And the answer is, we can bypass the problem. Which means, for example, if the couple has unexplained infertility, which means the sperms are not fertilizing the eggs in the bedroom for whatever reason, we can actually fertilize them in the lab and make an embryo and then put it back in the uterus. So that in this case, the test tube actually acts as a substitute or replacement for the fallopian tube, which means you bypass the problem effectively, even without knowing where the problem was. And I think this is just as well, because honestly, we don't really care about problems. This is not a research clinic where we're trying to find out why couples aren't getting pregnant. An infertility clinic wants to give infertile couples a baby. And the good news is our technology for doing that has become extremely good.